Why is BDD linked to suicidal thoughts? Imagine feeling so distressed about your appearance that it consumes every part of your day. That's often what happens with body dysmorphic disorder, or BDD. It's a mental health condition where someone becomes fixated on perceived flaws in their appearance, flaws that might be tiny or even invisible to others. This preoccupation causes intense emotional pain, leading to feelings of shame, anxiety, and hopelessness. Research shows that people with BDD are at a much higher risk of having suicidal thoughts compared to the general population. Studies indicate that up to 80% of individuals with BDD have experienced thoughts about ending their lives at some point. About a quarter have actually attempted suicide. These numbers are alarming and highlight just how severe the emotional suffering can be. The risk of suicide is higher because the distress caused by BDD is persistent and overwhelming. Many feel trapped in their negative thoughts about their appearance, believing that their life would be better if only they could change how they look. Another factor is that BDD often occurs alongside other mental health issues like depression, anxiety, or substance use disorders. These conditions can amplify feelings of despair and increase the risk of suicidal thoughts. When someone is battling multiple mental health challenges, it can feel like an impossible fight, especially if their BDD symptoms go unrecognized or untreated. It's also important to understand that many people with BDD do not openly share their struggles. They might feel embarrassed or fear being judged, which prevents them from seeking help. This means they often go without proper mental health treatment, leaving their distress unaddressed. From a plastic surgery perspective, this is critical. Patients seeking cosmetic procedures might actually have BDD, and if their underlying disorder isn't identified, they might undergo surgery that doesn't resolve their concerns. In fact, cosmetic procedures often do not help with BDD and can sometimes make symptoms worse, increasing dissatisfaction and emotional pain. Effective treatment for BDD involves therapy, especially cognitive behavioral therapy, and medications called serotonin reuptake inhibitors. These approaches have been shown to reduce symptoms and, importantly, to lower the risk of suicidal thoughts and behaviors. The goal is to help individuals develop healthier ways of thinking about their appearance and improve their overall mental health. In the end, recognizing the link between BDD and suicidal thoughts is vital. It reminds us that mental health is just as important as physical health. For those in the field of plastic surgery, it's a duty to screen patients carefully, to understand that cosmetic procedures are not a cure for BDD, and to refer patients to mental health professionals when needed. Ensuring patients get the right care not only protects their safety but also respects their rights and dignity. Remember, recovery is possible with the right support, and addressing the root causes of distress can save lives.